Hello, welcome to my presentation. Our topic for our group is the effects of motor rehabilitation using virtual reality. And for the purpose, we're going to be studying to examine the effects of motor rehabilitation using virtual reality. And in this method, there are 15 participants in this assessment. There are 7 males and 8 females. The experimental group are right-handed participants that were diagnosed with multiple sclerosis or MS for abbreviation, and the age range is from 20 through 40 years old. Obviously, the object, or the subjects, um, consent was informed for all the subjects. And this group, 3 males and 4 females, used the trajectory of virtual reality and had to track a target object projected on the screen with their index finger extended, traveling along a 5-segment trajectory for a total length of 160 centimeters. And the trajectory was designed for subjects to utilize multidirectional movements involving the lower leg joints and muscles in the 3 planes. And so the study will be focusing on the lower leg, specifically the joints and the muscles for patients with multiple sclerosis. And then while the experimental group are involved with virtual reality, there will be a control group of 4 males and 4 females that have MS, use basic traditional motor rehabilitation using manual therapy. 10-week motor control intervention was made to ensure the improvements of the shoulder scapular area, and three-dimensional motion analysis was used to evaluate and record muscle activation kinematic data during a full knee flexion. Normal range is 120 to 150 with respect in degrees and 3-plane movement. So after a 10-week intervention of both manual therapy and rehabilitation, the functional assessment classification was used to evaluate the range of the improvement of lower leg activation. 1, unable to walk, and 7, walk anywhere. Pre-training before the intervention, post-training after the intervention for each of the rehabilitation methods were compared. And so my design, or our statistical design, the null hypothesis was that there is no significant difference between the number of motor rehabilitation sessions and the degrees of joint range of motion. The independent variable is the joint range of motion on the lower legs after the interventions. The dependent variable is the FAC, or the functional ambulation classification between groups, measures, and ANOVA was used, and the alpha level was set to 0.05 to test and evaluate for significance. The data was analyzed using SPSS 27.0. And as you can see, the results, you see the mean and the standard deviation. Our p-value is 0.032, meaning that it was lower than the alpha, and so null hypothesis was rejected. In conclusion, both groups' performance in the depth planes was substantially lower than performance in the frontal plane. The variations were only noticeable in the frontal plane at the end of the baseline assessment. Impaired motor learning and MS patients for tasks require a more complicated system of visual and sensory motor information. The null hypothesis stating that there is no significant difference between the number of motor rehabilitation sessions and the degrees of joint range of motion was accepted. And so that is my presentation.